It's Sunday morning. Dr. Larissa rushes off to work. She can't quite relax when there are infants being hospitalized at Kapan Medical Center's pediatric department. As a matter of habit, she spends a few minutes with each patient. Liana, how is he doing? Did he sleep well? 4-month-old David was diagnosed with pneumonia. He's from Nagorno-Karabakh's Kashatagh region. His treatment, which began a week ago, is drawing to a close. He has recovered, thank God. We'll release him soon. Dr. Jangirian has been a pediatrician for the past 26 years. She transferred here from the Kapan Polyclinic in 1992, during some of the most brutal battles of the Artsakh War. It was horrible. I can't describe it in words. From these horrible years, Dr. Jangirian remembers one day in particular, when a missile struck the courtyard of the hospital. The blast shattered the windows. In the pandemonium that ensued, as everyone ran to the underground shelter, a child was almost left behind. There was a 2-month-old baby in a patient room on the first floor. The mother ran outside in panic, forgetting the child. But her sister quickly took the infant out of the crib and yelled, "Girl, where are you going without your baby?" The painful traces of the war were erased from the walls of the hospital only recently, in 2013, when the pediatric department was completely renovated. The renovation was made possible by the Hayastan All-Armenian Fund, with the support of a British-Armenian benefactor. An additional $1 million was donated by the fund's benefactors for a complete upgrade of the pediatric department's medical equipment. The intensive care unit now features state-of-the-art technology, everything that's required for saving a child's life. We're fully equipped to provide pediatric care, including intensive care. We have a respiratory care unit, where we can administer oxygen therapy to newborns and children. Dr. Ararat Harutunyan is the chief specialist at the intensive care unit. A native of Kapan, he has worked in Moscow for many years before returning to his birthplace in 2012. The technology we have, particularly in terms of intensive care, is among the best in Armenia. Today, we're capable of treating even the most critical of cases. The mother of 5-year-old Arno, who is undergoing intensive care, says that had her son been brought in his condition to the hospital 5 years ago, doctors would have at once sent him to Yerevan. Today, she doesn't need to drive 320 kilometers to have her child treated. Then there's the fact that Dr. Larissa has years of experience. Prior to the pediatric department's equipment upgrade, children's lives were saved here thanks to Dr. Larissa's sheer will and CPR prowess. I remember back in the day when we didn't have oxygen equipment, Dr. Larissa once administered mouth-to-mouth resuscitation, something that not all doctors are capable of. But since we work with children and our doctor is extremely conscientious about her work, we were able to save that child's life. Similar stories about Dr. Larissa are heard throughout Kapan. Everyone knows that she won't go home at night before the fever of an infant patient has subsided, or before she can convince a stubborn child to take a bitter pill to get better.